So our next speaker is a dedicated trauma surgeon who strives to improve patient care at every level. Dr. Syed Mohammed Sibtain currently works at a leading tertiary care trauma hospital, handling some of the most complex surgical cases with skill and precision. He holds an MBBS, FCPS, and AO trauma certification, and his passion for helping others began early through the Scouts. Since then, he has led basic life support courses and emergency surgical camps, spreading life saving knowledge. He also runs an educational social media platform, mentoring future surgeons with both skill and compassion. Now, I'll let Dr. Saptan take over. Over to you, sir. Thank you.
I'm here to talk about orthopedic surgery, orthopedics and trauma. So before I begin, I would request the audience to just take 2 minutes and imagine something. Just imagine the sound of chaos. Uh, it's not the irritating sound that you usually hear in OR, the irritating beep beeps of a cardiac monitor. Uh, it's not that, nor is it the whooshing sound that a ventilator makes. It's something more sinister than that. Imagine two cars colliding, the thud of a human body falling down, or the crack of a tree falling down. So that's where the story of orthopedic and trauma surgery begins. So, yeah, so with that in mind, I'm Dr. Syed Mohammed Sibtain. I'm a consultant trauma and orthopedic surgeon, and I wish good evening to all of the future surgeons. So, okay. So, the sound, that chaos that I requested all of you to imagine, that is where we begin. So, over the next 40 minutes, I'll take you on a journey of orthopedic and trauma surgery. So, a journey from that chaos to the operating room. That's where we begin. Okay, so oftentimes you would ask me, why orthopedic surgery? Why would anyone, opt for orthopedic surgery? We have so many options now. So it's a fair question. So when people often think of surgeons, they often think of, the steady hands of a neurosurgeon, the delicate work that a plastic surgeon performs. So, why orthopedics? So, we are like the carpenters of medicine world, the human body. We're the architects of the human body, rather. So, I'll let you on a secret. So, that's the closest that you can come to being a real life superhero. Yeah, and we all, we surgeons, we come with a fair share of ego as well. So, you can see that. Yeah. Uh, So imagine a patient comes to you broken, they've fallen, they've crashed, the world literally comes down to a halt. So they are in pain, they're horrified, they're immobile, and they're terrified. They place this trust in you, and with a combination of knowledge, skill, and some titanium and stainless steel, you get to hand them back their lives. You make them mobile. You start off with diagnosing their problems, and you fix it in the most tangible way possible. So I remember, as a resident in orthopedic surgery, I came across a young guy. He had a terrible gut injury, and I was in a fix what to do. So luckily, my attending, he took over. He guided me. He told me that it's a mess, but we'll fix it. Luckily enough, the gut part uh, could have been managed conservatively. So thereon, we took over and we fixed the young guy in 2 days post the trauma. And on the third day, he was standing up. The physios helped a lot, and that was one of the most amazing experiences of my life as a young surgeon who was just starting out. The feeling to see a crashed patient, in all sort of disarray, and then he would be standing up. That was magical, and that got me hooked, and it's still going strong. And that's the call, to solve a three-dimensional problem, to restore function, to restore mobility. So, it can come in various forms. You can give you can get a grandma to get up again and pick up her grandchildren, a mother. You can help a mother pick up her son again with the correct surgery, of course. So it's definitely not for the faint of the heart. It requires grit, determination, physical strength is a must, along with good knowledge and clinical skills. So, uh, so now this is a call. Why orthopedic surgery? So once you've chosen it, so how do you get there? Okay, so I began with naturally foundation year after my med school, and then I did my FCPS part one. So that is the entrance exam. Then I did 2 years of general surgery. In those days, it was 2 years. General surgery now has come down to 1 year, followed by 4 years of dedicated orthopedic surgery. And in the middle, there's an exam called the IMM, Intermediate Module Examination. Once you pass that, you're eligible to give the final exit exam after the duration of your training is completed. So I'll take you step by step there. So seems I'm sure might seem daunting. It's a lot of years, a lot of hard work. So imagine this is your own Mount Everest that you're willing to climb. So the base camp is the med school. I assume many of you are still there and you think it's horrible, but trust me. So it's not as horrible as you think. A lot of more horrible things are yet to come in your life, but that's the beauty of it. You get to cherish what comes after, so that makes it more bearable. Uh, so, so the path begins with the base camp. That's the med school. Uh, so you go 4 or 5 years in some parts of the world. I did it in 5 years, uh, where you get to see, you do anatomy or the basic sciences. Of course, I'm sure you guys know all of that. I don't need to repeat that. But it helps you once you get there. I still need to recall the insertion and origin of muscles that I used to take so easy in med school. But now I find it's invaluable. So yeah. So the ascent, the part two, once you're done with med school, you give your entrance exam, you clear it, then you come to the residency part. Okay, so I did it in 6 years. So 6 years of grueling hard work, mental exhaustion, physical exhaustion. It's brutal actually. So you will be hungry, you will be tired, you will doubt yourself. All of us do. Uh, you will learn to use a drill, a saw. You will use a 10-pound mallet with precision. Uh, it's not just that we don't suture. We sometimes have to. Sometimes we have to persuade the bone to go to a place that we want to, which is the anatomical or the correct location of that bone. Sometimes it's very stubborn. So it's physically demanding work as well. But that's also the part of the residency where the magic happens, where you do your first suturing, you close up the patient, you do your first reduction, with essentially putting the bone in the correct place once it has fractured. You do your first, uh, let's say, a POP reduction. You apply a POP cast once you've successfully done the reduction of the fracture. And that feeling is a drug. Once you've done it, you don't want to ever leave doing that. It keeps, motivating you. All the good hormones keep, pouring in your head once you've done it. So, okay, so once you've done the ascent, that's the summit. You're done with the residency, uh, 4 to 6 years of toiling, hard work, self-doubt, all of that. So, and then in the last, what I did was the exit exam, which in my case was the FCPS part two. So I had a couple of tries before I could clear it, to be very honest. It's very hard. So at least for people like me, I'm sure you guys are much smarter than I am. So uh, I took a couple of attempts before I could clear that. And once I did, I was through and it was a relief. So uh, the summit. Once you've done all of that, that's post fellowship. Once you've completed your residency, you that's where you gain critical experience, expertise rather. You gain all the cutting edge defining knowledge that defines you as a surgeon. That we usually that's more specialized. There are a lot of specialty in every field. With orthopedics, there's spine surgery, sports surgery, arthroplasty, which is the replacement of joints, so on and so forth, or complex trauma like I do. So this is where you learn all the cutting edge techniques that will define your career. So the entire quest, the med school, residency, fellowship, post fellowship, it's a decade of more of your life. It's a sacrifice. But the view from the top, it's amazing. You don't want to go back again once you've scaled that. So the reward, that's once you're done all that, you're attending orthopedic surgeon. So what does life look like post that? Uh, it's never boring, let me tell you this. Our day usually revolves around the clinic where we see the patients that are able to come in walking, to the wards where we admit patients that we are going to operate or have recently operated. And post that, we are always the one to frequent the emergency bays. We're often the first responders. Often we would get a call like emergency expected time of arrival would be 5 minutes, five gunshot wounds, uh, two critical patients. That's one of the most common messages that we get every day. Or a rollover, a car rolled over, and there's a critically injured patient. So this is where we take the lead. This is our normal breeding ground. So uh, this is the natural habitat of orthopedic trauma surgeons. We lead the teams there. We are assisted or helped by anesthetists, general surgeons, nurses, technicians. It's all a huge trauma team. So it's never boring, to say the least. So still the most rewarding part of the job, that's the OR. Uh, Let me paint a picture if I can. Uh, it's like it's a very complex pelvic fracture pieces. It's like a jigsaw puzzle. So the room's often cold, the music's on. Uh, so the C arm, that's the portable X-ray. So we often have to have creative minds, nerves of steel naturally. That comes over time. That's I think that's one of the quality that the residency program imparts on you. So uh, the fracture lines, we reduce them incorrectly. We take a final X-ray in the OR while operating. So we have a lot of technology now. So this is the reward. This is the reward of all that tumultuous, hard-working period that we came through. Uh, that's the, what we can give to public, that's the gift of motion, to restoring function as normal as one was before the tragic incident that took place in one's life. So this is why we do it. So, so where does all of this leave all of you highly intelligent people? So it might look to some that are still in med school or in the earlier part of career, it might look a very distant dream, but so it does not start just with the first day of residency. It starts now. So what can you do now to become a trauma or orthopedic surgeon right now? I would suggest be curious, ask a lot of questions. Steve Jobs once said, "Be curious and be foolish." I wouldn't ask you to be foolish. In that case, you would cause a lot of trouble to the patient and probably yourself. So just be curious in this field. Uh, Seek out mentors, find surgeons, shadow them. Just see what they do, why they do what they do. Again, ask a lot of questions. And one thing I would suggest, develop hand skills. That's something that would help you later on your career, mostly in all surgical careers. Do some type of sculptures, pottery, that sort of stuff, something carpentry. You'd be surprised how good sculptors Many of my surgical friends are. They're amazing. Some know all of the work that an electrician does. That's because it's essentially the same skills. We just have a lot more knowledge than them as far as the human body is concerned. So, and build your resilience. This path is hard. Definitely, it's very hard. So you need to be patient. You need to be you need to develop empathy towards patients. It always pays. Uh, and no matter what people say, the future is very bright. It's always bright. We have robotic surgeries coming in. We have the advent of artificial intelligence, which is making a breakthrough every day. In 6 months, it takes a leap. So you should be well aware of how it could impact you or your chosen field. So you have the chance to be more than a doctor. It's to be an architect, a creative person. Uh, so so when you hear the sound of a screech of a metal, the cry for help, I'll hope you remember this talk. And I hope you will have the courage to answer this call. And I thank you all, and I hope to see all of you future surgeons in the OR someday. Thank you. And I'll
And
welcome any questions.
yeah, thank you so much, guys. We'll start taking in the questions. So whatever questions you have, start leaving them in the chat box. Okay, so the question is, how do trauma surgeons stay calm and make fast decisions under pressure?
Okay, so that's a very good question. So that comes with a lot of training. As I said, I did 1 year of foundation year and then essentially 6 years of general surgery and then trauma surgery. So there are repetitive patterns that we follow. We are taught to to act a certain way. It's not God gifted. We're taught that way. So we do a lot of drills pre-hand so that once the actual occasion comes of that chaotic scene, so we know exactly how to behave. Like I said, we're often the leaders in a trauma situation. So we all have memorized and gone through that training that helps us to make quick decisions. We know what's best for the patient. We know uh, by instinct or by knowledge that how to go about things. So that's training for you. That teaches you how to be calm, how not to faint well when you see an auto amputated limb. You know how to act. So don't worry. That's residency for you. It teaches you that.
The next question is, how does the daily routine of a trauma surgeon typically looks like?
Okay. So like I said, uh, so we have the clinics, the wards. It starts actually with the wards. We get in the morning, we see all the operated patients that we operated on yesterday, or the ones that are soon to be operated today, tomorrow, or on that day or the other day. Uh, then we have the ORs. That is the favorite place of any trauma and orthopedic surgeon. So we have a saying that we have an in time, but we don't usually have time to sign out. So as long as the surgery takes, as long as the cases take to complete, we're there. And we're very frequent visitors to the emergency department, the trauma base. I work in a very busy trauma center, so we have the worst sort of trauma cases. So you'll often see me or my companions or my colleagues visiting the trauma bay. We'll be giving our 2 cents in the chaotic environment. So just to give you a picture, it's never boring to say the least. It's something is always happening. One moment you'll be sitting quietly seeing a patient. Other moment you'll be given an emergency call and you'll have be rushing either to help a colleague out in the OR or to help a junior resident out in the ER to fix a fracture that he can't, fix it. So yeah, it's very exciting.
What is the hardest thing about being a trauma surgeon?
Uh, has a couple of hard things. The timings, I would say, uh, for days we'll be operating. Sometimes the incoming trauma is the numbers are so vast that We'll be operating the whole week along with our clinics, but sometimes we have such critical fractures that we can't postpone them for a lot of days. So I think the timings, for me at least, yeah. So those are the hardest. Once you've built the physical resilience, the grit to stand up in the OR every day, to combat the back pain, yeah. So once that actually becomes normal during the residency, and after that, timings are the most important thing.
So do the hands just get used to being light and precise in surgeries?
I'm sorry, can you come again, please?
They're trying to say that the do hands just get used to being light and precise in surgeries, like after experience.
Oh yeah, definitely they do. Definitely, no one. I don't believe in born talents. I haven't yet to meet a resident who, in his first year, is amazing. That does not happen other than on TV shows. So gradually, you hone your skills, and that's what attendings like me do. We teach the residents. We teach them. Obviously, there are a lot of workshops, so you're required to take all the workshops while you're training. Those are formal workshops that you need to attend and complete and pass to move forward in your career. So they help a lot as well. And then, of course, uh, as you go, you improve, your skill level improves, your hands become more steadier with time. You gain more confidence once you see that the person you've operated, he's walking all right and he's okay. So that helps a lot.
Is it possible for someone who is a slow learner and less intellectual to become a trauma surgeon?
Yeah, that would be me. So if I am here today, so can you. I don't think uh, there's any metric or any way to gauge how quick someone should learn. Uh, I don't know. That's just people defined. So people, they improve. Somebody would pick something up in one day. Some would take a week. That's normal. So as long as you have the will to do it, you have the grit and determination to keep going back and back, back, back. I think you should be okay.
The next question is, can you share a case that significantly impacted how you practice today, like a personal case or something?
Oh yeah. I have quite a few actually. Like I still remember the one I mentioned, the one young guy who came. He was as old as I was at that time, and that sort of resonated with me. That's what happens. Uh, have feelings as well, and they get activated at times. So it happens a lot of times. Oftentimes, when you see a young child, uh, so the elbow fracture, supracondylar fracture, that's one of the most commonest that you would see children coming in with, children smaller than 5 years. Of that's one of the most touching fractures, or any other fracture that a child has. So that's one of the most touching fractures that I have, have affected me. Uh, Other than that, I've operated on old people who have, they've given up on life. They've not moved for months or possibly year or so. I recently operated on an old lady. She was pretty depressed. She didn't think she would walk again. She had a broken hip, so I replaced that. And next day we made her stand up, and she was so happy, and I could feel the hope coming back again on her face. And that's those are the things that I live for, and all the orthopedic surgeons live for. And we don't forget that every case, every patient that we operate on, they remain in our memory, at least for a lot of years. So yeah.
That's truly inspiring, Dr. Sibtain. The next question is that what are three words you would use to describe trauma orthopedic surgery field?
Oh, it would be high paced, physically demanding. That's actually three words, but I'll add in a more. Uh, and sharp thinking.
How competitive is securing residency in trauma surgery compared to other surgical specialties?
Okay, so it's one of the most busiest residency programs, at least in Pakistan. So yeah, so I did my residency from Indus Hospital, Karachi. So that's one of the top three residency spots for orthopedics. So it was pretty difficult. We needed to have some things that would, outshine us as compared to our competitors. So there are good thing is there are a lot of places that offer training for orthopedic surgery as compared to say possibly interventional radiology, but I would say to get into a really good one, that's very competitive. I've often seen people waiting a year to just to get into a good program. So yeah, it is demanding, it is difficult to get into, especially a good program.
How do you maintain work-life balance in such a demanding field?
I don't. That's what I said. That's one of the most yeah, but on a serious note, uh, we sort of work our way through it. Our families, they learn how to adapt. We learn how to adapt. Oftentimes I would get home at 11 at night or 12 at night, but then uh, I would go around doing any, normal family chores that anyone would. So definitely that is one of the con of trauma and orthopedics. The work-life balance does get disturbed. It's very actually hard for younger people, like in residency. Uh, you miss a lot of family events. Uh, Oftentimes you would be on call or in a surgery, but that sort of becomes your second nature with time. So you sort of work through it. We're always running around from one place to another. So that's how we sort of complicate it, or rather we learn to deal with it.
Okay, what is the most common conception about your job that medical students or the public have?
Oh, okay. So when people usually think orthopedics, they don't have to study a lot. It's mostly just, brute physical power and plates and screws. Let me tell you that I had friends in almost all of the surgical specialties, and I always used to have the most books, uh, as do all of the other orthopedic surgeons. So that's one of the most biggest misconceptions with orthopedic surgery, that you don't have to study too much. Let me tell you this, you have to study a hell lot. So, uh, yeah, so be prepared to be physically fit, energetic, running around, mentally sharp, and to be able to study a lot of books, research papers, and all of the cutting edge stuff that keeps coming out every day.
Then we have that what kind of injuries or emergency do you see most often?
Okay, so I see a lot of complex trauma. So what that means is a lot of complex fractures that need to be operated. And since I work at a very busy tertiary care trauma center, so we oftentimes have compound injuries where uh, we'd be working alongside general surgeons, vascular surgeons, and plastic surgeons. Uh, it will be a combined joint effort. So we have a lot of polytrauma. So you would see me working on a lot of polytrauma cases where there'd be two long bones fracture along with a gut that's shot at, uh, and then there would be a soft tissue defect, uh, which would require us to call a plastic surgeon into the case. So oftentimes even a neurosurgeon if there's something involving his specialty. So you would see me working on a lot of complex trauma cases.
Okay, so I'm gonna ask the last question, which is what advice would you give to someone who's passionate about trauma surgery but is hesitant or intimidated by the competitive nature of this field?
I would definitely, from my personal experience, I would recommend to not give up. be persistent. It's not it's not necessary that you get picked up in your favorite residency program in the first attempt. Does not matter. Time is just how we calculate it. So you could have another go at it, possibly in another year. In that time, you could gain some valuable experience elsewhere and then retry. Persistence, to say the least, is the biggest quality that you need to have to be a great orthopedic and trauma surgeon.
Okay, thank you so much, Dr. Sibtain. So we'll be wrapping this last and final segment of the annual conference here. It was a pleasure to have you, Dr. Sibtain, and I'm pretty sure we all learned a great deal from you. Thank you so much
Thank
for
you.
having us and giving us a great talk. Thank you so
Thank you so
much.
much. It was a pleasure to me as well. And I hope to see all of the future young surgeons in the OR with me sometime. Thank you.
Thank you, inshallah. Thank you
Inshallah.
so
Thank you.